The Waitangi Tribunal inquiry into the Health Services and Outcomes kaupapa inquiry was held last week at Papakura Marae. The hearing has a particular focus on disabled whānau. Whānau Ora Chair Merepeka Raukaua Tate, Nō Te Arawa, gave evidence before the tribunal on Friday and she's with us now. Tēnā koe Merepeka, thank you for joining us.
Yes, kia ora, thank you. Nice to be with you.
Well, how does what's widely considered to be a systemically racist health system manifest for disabled whānau?
Well, disabled whānau have significant barriers and challenges, as you would appreciate, and all they're asking for is access to services that all New Zealanders are entitled to, and indeed that the majority of New Zealanders get. So when you look at Pacifica and Māori families, they know that nobody really do they get the services that are provided by GPs and other health providers. Really do they get those services without having to advocate strongly because they're in a position that allows them to, I have to say this, they're always having to battle to really get good services. And that is, of course, that the system doesn't take into consideration that their disability that they have, that has been with them for such a long time, makes it so difficult for them. And so it really is systemic racism that is existing in our health services. And it's been there for such a long time.
And I suspect if they don't have their own voice and someone to speak for them, they can easily be overlooked. So what are some of the challenges people with an intellectual disability face every day within their communities and even for their whānau?
Well, first of all, they want to be included. They want to feel that they're valued as human beings. They want access to good housing. And also, of course, they want to be, if they can, they want to be able to have some meaningful engagement during the day. And that's really what they're wanting. They want to feel that they're valued as human beings. They want to feel that the community in which they live, makes them welcome and is inclusive of them. And so often that is not the case. If you have a disability, in many instances, you're marginalised. You're off to the side, and so often they just believe that nobody really cares about them and wants to make sure that they're living meaningful lives.
And you have referred to hostile environments and institutionalised racism. How is racism exposed in these environments?
Well, certainly by the range of services that are provided for our families. So they try to get good access to good services, but usually they're having to constantly advocate the whole time to get decent services, and that is tiring. It's tiring for the families. Oftentimes the families are seen as a nuisance because they're there advocating for the services that they know that their family members are entitled to. And the environment is so often, it is hostile to them. And then many times the families are not given, at the end, the families are not given any consideration. They are moved to the side. And so the person with the disability has to try and advocate for themselves. And that is, and then they're always on the back foot. So it really is, it's a system that has developed over time. And that's why when you hear the voices of the families who have members with a disability, you know that they're up against it all the time.
So what then you feel needs to change to ensure a more inclusive process for all whānau?
Well, they should be given the range of services that every other New Zealander has come to expect. Good access and affordable access to GPs. They should be able to have early support provided for them and meaningful support. They should have a range of providers that they can go to if they want a kaupapa Māori service provider, and they should be able to get that. They should have services that they can assist in the development of those services as well, so that they know that what they're getting will make a difference to their lives. And certainly whānau should be included in the development of those services as well. It's not rocket science, it's just that everybody wants services that meets their needs. It's never a one-size-fits-all. And don't look at the person and see their disability first. Look at them as a human being. For us and our services, we look at that person, that's a Māori, they're a Māori family, so we look at that first, and then we see what their needs are. And that's the difference that we should be expecting now.
Merepeka, just very quickly, do you know of any medical providers currently meeting the needs of disabled whānau?
Yes, there are some, and there are some that are working very hard to do that. But I think on the majority, and what we heard over the last week, is that for many people who do have a disability, then they have to search for somebody all the time who will not brush them off, who will recognise that family are important and they want to be there at the time there's consultations. But there are some good providers out there. But certainly the battle is not over for
Right.
people with a disability.
A lot more needed. Whānau Ora Chair Merepeka Raukawa. Thank you for your time today, ngā mihi.
Kia ora.